lowered the standard academically because I was actually a football player there. So, and I moved to Tennessee, so I'm going to have to try to become an SEC fan, but it goes against everything, but I'm going to do the best I can. But thank you for that introduction there. So I'm going to talk about the exciting, really important topic, which probably you don't give much thought. Most people don't think about this much, and that's the idea of managing infection risks in healthcare laundry. So I think healthcare laundry, or we don't really think of laundry and linens and textiles in hospitals, but they're actually a very, very important part of a hospital's infection prevention strategy. So what I want to do, my goal today is to kind of shine the light on how important this topic of textiles in healthcare is, and also look at one is look at how it's done, because many people don't understand all that goes into that. And then two, look at some of the hidden risks that are out there, hidden and visible risks that are out there with textiles in healthcare. And then finally, hopefully arm you with some tools and strategy to mitigate some of these risks. So before we get started, I really want us to put on our Sherlock Holmes observation hats here, because like when looking at linen and looking at risks with linen, sometimes we have to look a little bit deeper, and things aren't necessarily as they appear to be. So something might look clean, or a practice might look harmless, or everything might look fine. But then when we take that magnifying glass out and look closer, we might say, hey, this is actually there's a real risk here. So we're going to play a little game here, and this is the observation game, just to get us all going. So you see a picture here, right? It's just a normal little picture. But if you look more closely, or actually if you blur your eyes, you'll see some faces in the background of that picture. So our first exercise today is, how many faces do you see in this picture? And you can just go ahead and answer in the chat. Okay, I see one here. Okay, so I will give 15 more seconds. Okay, we have a 13, we have a 6, we have a 5. I feel like there might be a cheater in there. I don't know who that could be, but the correct answer is 13. Adriana, good job. The host got the thing. She may have seen the slides. I'm not saying anything, but here's all the pictures in there. Here's all the faces that are in there. So good job, everyone who did that. So now that we have our observation hats on, let's get into healthcare associated infection mode. And let's many of you have maybe seen these statistics, but I'm just going to go through some of the HAI statistics that are up to date. So there's more than 1 million annual HAIs in the United States alone. And this is from the Agency for Healthcare Research and Quality. So this is a really big number, but this number is only the United States. And this number, I think, only accounts for a subset of healthcare. So I think there are other areas of healthcare that I believe skilled nursing facilities aren't in here. Certainly home health numbers aren't in here. And I think some other clinic types of things are probably not in here. So I would guess that this number is a lot higher than it actually is. And there's tens of thousands of associated deaths each year. The statistics that I think is really scary is 1 in 31 patients has at least one HAI, again, from this subset. And they cost billions of dollars annually to our nation and really to the world. So when we look at one of my goals as a laundry compliance expert is to really mitigate all of the potential HAIs that could be coming from linen. So with that, there are, since the mid 1970s, there are 23 documented outbreaks, infection outbreaks tied to linen since the mid 1970s, impacting about 650 patients. To me, that's a really good number for the industry, because if you consider there are 5 billion pounds per year of linen processed, boy, that's really an impressive record for the laundry industry. So that's good. We should all pat ourselves on the back and be happy that that number's higher. But, and there's a big, 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 big but in there. These are the documented ones tied to linen. But I'm going to show you some statistics afterwards that show maybe there's some other stuff going on that we really need to be aware of. And I think the important part of this topic is we don't want documented ones. We don't want undocumented ones. We want to just eliminate this problem completely with following the highest standards and practices that we're going to go through right here. So a little bit more on this. All 23 of those outbreaks were preventable. And then the question is, okay, well, how were they preventable? Well, all were caused by non-compliant laundry processing. Some examples, which I'm going to go through these in more detail later. So the linen was unprotected during transport from the laundry to the hospital in one case. One case, there was a dirty washer seal. So that's kind of an environmental issue. One case, there were damp, moist textiles leaving the plant. And we all know that pathogens love to live in damp, moist environments. One, there was dirty rinse water in the washer. One, there were dirty carts. That's another environmental area. And then one, there were improper wash frames. So all of these things that caused outbreaks were all preventable with good laundry practices. So let's look at some other studies to shed light on maybe when we look a little bit deeper what's going on. So there are several studies that have showed fabrics contribute to the spread of multi-drug resistant organisms. So MDROs get on a fabric. I mean, they can contribute to the spread of that throughout healthcare. Privacy curtains, which sometimes we don't think about those that much. Those are those curtains that separate for privacy rooms or suites. So those can be big breeding grounds for resistant bacteria if they're not paid attention to. And then there are lots of reports of microorganisms on textiles, and these are obviously a possible source of infection in patients. So let's understand a little bit how germs spread and can contaminate linen. So I'm just going to give a very basic overview of some things that can happen here. So something's used, a towel or a gown from a patient, and then it goes to let's call it a bed sheet. So now that bed sheet gets contaminated from the patient because that patient maybe has an infection. After handling the bed sheet, the worker doesn't clean their hands. So now there's a pathway for that worker to have that contamination on their hands. Then the worker touches the bed rail and fluffs the pillow, let's say, of another patient, and bingo, that's all it takes. Now that patient and that healthcare worker could be contaminated. That's just one example of literally thousands of scenarios that can happen. So what I want to do now is I want to dig a little bit deeper into what does this process look like? When I first got into this business, I thought, oh, it's very simple. You do the laundry, or the patient uses something, put it in the hamper, do the laundry, and then bring it back to the patient. But my goal with this is to dig deeper and help you understand the end-to-end laundry process, what's going on, where the contamination risks are in the different steps, and then what you can do about them. So what I like to do is this thing called a day in the life of a hospital textile. And we're just going to do one of those kind of fun, I don't animate it. You've seen those fun cartoons where it's animated and it goes through, but I'm not that sophisticated. So I'll just walk you through this. So the first thing that happens is the textile, let's call it a towel, is used at the hospital. And once it's used at the hospital, a nurse or someone will take that dirty textile and put it in the hamper bag. Pretty simple to be laundered. On the surface, that's pretty simple. Now, let's look at the infection risks. So one, if that person is not wearing didn't practice hand hygiene or is not wearing PPE, guess what? Their hands could become contaminated or their bodies could become contaminated. So very important that they clean their hands before and after handling it. Next thing is, are they handling it properly? That is, not touching other clean surfaces, not shaking it around and getting all the contamination on all this other stuff that's out there. Are they segregating this thing and containing this in a leak-proof, strong soiled linen hamper bag? Because if they're not, then that the bag could break, or they could get it on clean linen if it's not segregated, and this cross contamination thing could happen, which is a word that I'm going to throw around a lot. That basically means dirty stuff, just like in a kitchen, is going to contaminate clean stuff. We absolutely don't want that. Is there regular cleaning and disinfection of the surfaces that this is touching, such as the bed rail or such as the hamper stand or other things that it's touching? And are there other non-PPE wearing employees or staff or patients that could be accidentally exposed? And then I guess the final one on that is, are these textiles put into a red bag or are they put into the correct uh, bin? So I'm going to do a little bit of a digression here right now, and the question is, this is pretty interesting. Who here thinks, you can chat in, bloody soiled textiles should go into the red bag or they should be disposed of? And you can just answer in the chat. So this is a common issue in healthcare, and it's actually a very expensive issue. And the answer is no. Soiled textiles are done by a healthcare laundry, both either in-house or uh, they can also be done at an offsite laundry. But it's actually very, very important that we don't red bag soiled textiles, because one, that's very expensive because you have to buy new textiles, and these are meant to be reused. And then the other reason you don't want to do this is because that's what healthcare laundries do. So with correct sorting and washing and drying and inspecting, healthcare laundries get blood, bodily fluids, and other things out of textiles. So this is a cost thing, but yeah, we never want to do that. The laundry can always, even if it's grossly soiled, the laundry can, not always, but 95% of the time, get those guys clean so they can be reused. Okay, so now it's in the hamper. Hopefully it's contained and the hamper bag is labeled and everyone's washing their hands. Now this hamper bag is transported uh, is transporting the soiled laundry in the hospital. Where are they transporting it to? They're transporting it to, if the hospital has an in-house laundry, to the laundry staging area. If there's an outsourced laundry, that means it's taken off-site to be laundered by a professional laundry. Then it's typically put in the loading document, or in the loading dock, ready for that. So basically we're taking it from the patient floor and then we're taking it to the loading dock or to the laundry. What are some risks? Kind of the same risks as before. Use standard precautions, wear proper PPE. Don't reuse the containers that have been holding clean or that have clean linen in them for the dirty. Never ever commingle the clean and dirty textiles together, because guess what? If you do that, then the clean textiles become dirty and everything's dirty. On this journey, it's important to avoid clean areas. So, don't take the dirty linen right through the ICU or right through an operating room while something's going on. And then, very, very important, if you must use the same cart uh, that had clean textiles in it. Make sure once the soiled textiles are out of there that it's cleaned and disinfected according to the standards for how to do that with an EPA registered disinfectant and following the label claims on that. Okay, we're at step 2. Okay, step 3, the linen, the soiled textile is now taken to the laundry. So here's just a picture. This is actually a picture from a laundry that I'm familiar with. When you see this, hopefully after the presentation, you'll be more versed in this. But if you see this picture, you should be like, oh my goodness, what is that man doing? And the issue there, so what's happening practically is the soiled linens being taken to the laundry. But the risks for this thing are, one, this person, and I had this picture here for a reason. This person is handling the linen carts with no PPE, no gloves, and it looks like from that picture there's dirty linen and clean linen in the same truck, which is cross contamination, a pretty big no-no. So hopefully the people clean their hands before and after handling that. They wear proper PPE. There's functional separation in the vehicle. That means no soils and cleans commingled together. And if there are soils and cleans commingled together, then there's very good protection of both the soil and the clean through they're not touching each other. There are maybe wrapping of the clean, there's wrapping of the dirty, but we don't want any possible way that the clean textiles can become contaminated by the dirty textiles. We also want to clean the vehicle after every use. And this goes for in the hospital and it with an offsite laundry. And then finally, this is really important, but something that we wouldn't think about, are the carts secured? Because guess what happens if the carts aren't secured? When the driver hits a bump, it's going to fall over and all kinds of bad things are going to happen. Okay, so now we are at the laundry. And this is a very, very, very part, kind of the first step in laundering, whether it's in-house or whether it's offsite, and that's called the soil sort. So what's happening here is what we're doing in the soil sort is we're sorting like items with like items. And that means items we can wash together through color or through fabric types or even through soil load. And then we're also making sure that they're soiled into the right sizes so that they'll wash optimally. And I'll get into the wash a little bit more later in the actual washer. So if we're not sorting properly, all kinds of bad things happen. So just a good example, if you have a very, very dirty soiled load of operating room towels, and then you mix that in with a very light soiled load of, say, patient gowns from a MRI area, and then those guys are washed together on the gentle formula, guess what's going to happen to the OR towels? They will not be clean. So soil sort, really, really, really important. Also very important to remove non-linen things in there. So just we want to remove paper and garbage and sharps is a very big thing, and uh, maybe medicines. Hopefully we don't get that, but that always happens, or potentially even drugs are going to be in there. So we really need a good thorough sorting process. We want to make sure that our sorters are wearing proper PPE. We want to make sure that they're washing hands before and after doing the sort. And we want to make sure that they're doing environmental cleaning of that area regularly in the sort. Otherwise, that area is going to be a risk to all the workers that are in there. So that's the soil sort, kind of the first step of the laundering process. So the next step is we're actually washing the textiles. And I'm showing sort of two different models here. This is a large, what's called a tunnel washer, or other people call it a continuous batch washer. And this is a really, really big cylindrical looking tool that washes very quickly. And a lot of the outsourced big laundries have that. Or this is just a normal conventional washer. both have their uses, and these are found lots more in hospitals or maybe nursing homes or smaller laundries. These are usually in the big guys. And I'm going to try to show pictures of both because they're both used very frequently. So what's happening here? Okay, the textiles, now that they've been sorted, they are washed. And there are three things that make all hospital textiles get clean in the washer. They're very simple, but it can look very complicated. One is temperature. Do we get them uh, hot enough for all of our chemistry? Number two, to work. And number three is agitation, or what some people call mechanical action. And then these are all happening for the right amount of time. So if we do these three things correctly, time, temperature, and chemistry, uh, and agitation for the right amount of time, the textiles will get clean. If they're not cleaned, one of those things didn't happen. Um, so what are some things we want to look at? Obviously, these people are handling soil textiles, so we want to make sure that they're wearing proper PPE and also practicing proper hand hygiene. We want to make sure that the right textiles are washed in the right washer. So, for example, if you have a large continuous batch washer that's really big, you probably don't want to put in there something really delicate like a cubicle curtain because all kinds of bad things will happen. We want to make sure that the proper wash formula is used. So we want light soil formulas for light soil, heavy soil formulas for heavy soil, and specialty ones for specialty. Very, very, very important. And the big reason a lot of things don't get clean, we want to make sure we have the correct weighted laundry load in the washer. Because if it's too heavy, and there's too much laundry in there, then we're not going to get the right chemistry, we're not going to get the right agitation, and it's not going to be clean. If it's too light and the what's in there is too small, then guess what? That's going to be filled in with water. You're not going to get the right mechanical action, and the chemistry ratios are not going to be correct. So washing textiles also, this is a dirty area, so we want to make sure that there's functional separation and no clean textiles near there. And then obviously we want to make sure the textiles are clean. How do we make sure they're clean? We can do it visually. If they look dirty, they're dirty. We can do it by smell. They smell bad, they're probably not clean. Or in extreme cases, we can have them microbiologically tested in a lab just to, and this I would not recommend doing every time. It would be too expensive and it would take too long. But if there's something going on and you want to really be sure that your laundry processes are working well, this can be a good way to kind of monitor that washing process. So simple, we washed our textiles, we're done, right? Nope, that's a rhetorical question. I have a saying, it's relatively easy to get our textiles clean. Just do this stuff. It's really, really, really challenging to keep them clean from the out of the washer until the patient use. So let's go through the rest of that journey going through risk. So now the textile is unloaded from the washer and then staged for the dryer. Here's old school conventional washers where these ladies are unloading them from the washer. And then here's the new tunnel washer, continuous batch washer, where there's a lot more automation and uh, conveyors and hoists and all this stuff that's loading them automatically. The important points here, now that it's clean, we're in a clean area. So that means we need to separate this clean area from the dirty area. And some things to look for is, are there functional separation with air or with walls or with space? Is it the proper dryer for the textile being dried and the proper formula on that? What about, now we're looking at potential ways it can get contaminated. So is the air in here okay, or the air here okay, or is there lint all around it or other contaminants? Is the airflow correct? Are these workers' uniforms clean? You can see this scale's touching the textiles, this scale's touching. So if their uniforms are not clean, guess what? The textiles could be contaminated. Certainly, are their hands clean? So now we've staged it for the dryer. Now we're actually drying it. And here's again a tunnel washer drying system, kind of an array of dryers, lots of automation. Here, maybe this is more like what's going on in your facility where there's conventional washers, very manual, uh, from the textiles being dried here. So are they loaded into the dryer and dried properly? Is there functional separation? This is a clean area. This is a clean area. We want to make sure the air is clean. There's no lint. Are the hands clean? Are the surfaces, are these carts clean? Because if they're not, contamination. Are these conveyors clean? If not, then there's contamination as well. Uniforms again. And then very important, are the textiles dried optimally? If they're too dry, that's not good. You're going to destroy them, and that hurts patients. If they're too damp, now we can harbor all kinds of microorganisms in those damp textiles, and that's not good either. So we really want them to be just right. Okay, now the towel is transported to the finish, and I apologize to CDC folks. I didn't fix this slide. You told me to fix it. I apologize. The finish in a laundry is the clean area, and the clean area where things are inspected, folded, loaded on carts, and then loaded on trucks. So the towel or the textile has to be moved to this finish area. Here's a manual way in a cart. Here's an automated way in a conveyor. And things to look for, the finish area or the clean area is a clean area. Must have functional separation with proper airflow, clean surfaces, disinfected here, disinfected carts, disinfected hands, clean uniforms. These are all risks that, if they're not done, can contaminate the textile on the way to this finish clean area. And then in the laundry now, the textile is inspected for defects or dirty or integrity issues. It's folded and then it's staged to be taken to the hospital. So once again, is there functional separation? This is a clean area. Is there proper airflow, positive airflow from this area to the dirty area? Are the carts cleaned and disinfected? Is there lint around here? Is this environmental clean? Are they properly inspecting the linen, finding the defects? Are the uniforms clean? And then are the machines clean? So these are automatic machines. If the machines are dirty, guess what? The linen's going to get dirty. So I will tell a quick funny story. In my laundry, we used to hygienically clean test linens regularly at when they were ready to go to the customer. And in one period, we kept finding they were contaminated. So we looked at the wash formulas, all good. We looked at the dryers, all good. We looked at the carts, all good. We looked at the surfaces, all good. But this kept happening. They kept showing up with big levels of contamination. So we thought, what the heck? What the heck is going on here? So it turned out that the employee that was taking the textiles uh, from into the finish area, the clean area, was grabbing them like this, and his uniform was contaminated, and that was contaminating the textiles. So kind of an interesting uh, point on the value of doing that kind of process monitoring or testing of your linens throughout the process, just to see where contamination may be happening in the process. So now that the textile was loaded onto the finish cart, like this guy, for transport to the hospital, whether it's in-house or whether it's outsourced, we have to look at, again, this is a clean area. Is there functional separation? Is the cart clean? Has it been cleaned and disinfected? Is it protected? Good job. This one's protected here. Is it inspected? Good job. Looks like she's inspecting it. Are the people loading it practicing proper hand hygiene, both before and after? And is the employee's uniform clean so that that doesn't contaminate? So now we have the finished cart loaded onto the delivery truck and ready to transport to the hospital. So functional separation in the truck. Are the surfaces clean? Are the carts protected? That's good. Are the carts secured? Yep, I can see they're secured there. Is this guy using proper hand hygiene? Is his uniform clean? These are the considerations for this part of it. Uh, Now the delivery truck's transporting the textiles to the hospital. Is the truck clean? Are the surfaces clean? Are the carts protected? Are they secured so they don't fall over? Now the cart is unloaded at the hospital. Once again, so this is the hospital loading dock. Is there functional separation? Hopefully there's no clean and dirty commingled right here on the loading dock. Hopefully all the surfaces are clean, the carts are protected, and the driver and handlers are practicing good hand hygiene. Okay, now we are into the hospital linen room. Every hospital has a linen room. The linen room is actually a pretty big risk area in a hospital. How's the air quality in the linen room? We want this to be devoid of lint, hopefully filtered air, hopefully air conditioned with positive air pressure in this linen room. Are the surfaces clean? So there's cart surfaces. Hopefully there's a regular disinfection program where that's happening every day. Is there functional separation? We never ever want to put the dirty linen in this same room with the clean linen. Hand hygiene, very important for handlers in this linen room. Clean uniforms, very important for them. And exit and entrance controls. Make sure that people who come in there have uniforms on, have practiced good hand hygiene. We don't want anyone being able to just walk in there and potentially contaminate the stuff. So now, depending on how big the place is, most textiles in a hospital would go from the linen room up the floor or down the floor or wherever into a linen closet. How's the air quality in here? Uh, are these surfaces washable and clean? Because if they're not, if they're wood or porous, then they can't get clean, and that's a contamination risk for the linen. Is it devoid of lint? Hopefully, this is an area that's cleaned regularly. Functional separation from other areas of dirty linen. People working here must use proper hand hygiene and have clean uniforms. Oh, I spelled uniform wrong. Sorry about that. One other thing that's worth mentioning here is, and I didn't mention this, but this is important. If there are stacks of linen in a linen closet or on a linen cart, and you're just rotating things off of the top, you probably want to grab things from the bottom, because what I've seen happen is textiles will just get stuck on the bottom if it's a first in, last out thing. And then sometimes these textiles on the bottom here could be here for months and years and probably are gonna lose their cleanliness in that. So it's a good practice to be mindful of the necessity of uh, rotating this, guys. So now the textiles put into the patient room, same thing, air quality, clean surfaces, no lint, functional separation, hand hygiene, everyone using it. And finally, textiles used by the patient in the hospital. Hopefully, after all that, it's still clean. So hopefully you got out of that. Wow, those are so many steps, so many things have to be done right, and so many opportunities for contamination there that you'll look at this differently and open look at opportunities for contamination and hopefully fix those things. So what now that I've gone through the process, I want to go through, as someone who's been doing this for a long time, both as a laundry person and as an accreditation person, talking to a lot of infection prevention people, EVS people. I want to go through some of the top hidden risks with linen, and these are those ones that are kind of hard to see. So and I won't spend too much time on these, but I think it's good to just be aware of these, because these are things that you can look for. So number one, pretty obvious but really important, is incorrect documentation. So where your linen is processed, it's very important that there's documentation for that whole process. A QA manual based on standards, training records, manuals and policies for how to wash, how to dry, how to inspect, how to handle equipment, uh, signatures showing that people have been trained on this. And if we don't have documentation and people are kind of winging it, that's a problem for infection prevention. Infection prevention needs a playbook, and laundry is a big part of infection prevention. So how do you, if this is your situation, how do you fix this? Well, get help from your infection prevention and control team. I advise everyone to do a documentation assessment to make sure they have what they need, modify, correct the documentation, and review it regularly for compliance. That doesn't mean, once every 5 years, but that means you want to look at that several times a year to make sure everything is still up to date. Okay, next one, pretty easy. A dirty environment then this is the laundry or the hospital. So many times in a laundry or hospital, I'll see lint or clutter or dust or garbage or oil or grease or tape, all big contaminants for linen, and it's impossible to keep linen clean in a dirty environment. So there's obviously patient safety risks for this, and it doesn't look very nice either. It harms morale for the staff. So I think it's really, really important to not only have cleaning policies, training, and proof that the training is happening through checklists, but also uh, obey these things and check on them, monitor them regularly. And sometimes there's not enough room, so you might have to change the layout to keep the environment clean. Okay, next one is there's a kind of a funny cartoon here. The patient in the next bed is highly infectious. Thank God for these curtains as the guy's holding or he's grabbing the curtains. In a hospital, the linen program can be great and the linen can look great and the towels look good and the scrubs look good and everything looks good. Lots of times people don't think about the cubicle curtains. And cubicle curtains, as I said earlier, can harbor all kinds of different contaminants on them, and they can be really hard to manage uh, the cleaning program for them. So basically, it's a high touch area in healthcare, and there's lots of studies that show harmful germs on them. What can you do is make sure cubicle curtains are part of the laundry, part of the cleaning. Have a program where these are taken down and changed regularly, uh, and you're tracking this. So and solicit help from your infection prevention control team for how to do this. But a couple things are important in this is know the inventory of what curtains are where, know when you need to clean them, and you should have a policy for cleaning them and rotating them out, and then track when that is done so you'll know to do the next one. So it's not as simple as just throwing them in the washer, but we need to track that this is in fact happening or it's not happening. And this is another thing, if you're inspected by your accreditor or your Department of Health or someone like that, more than likely they're going to look to see if you have something like this. So we want to be on top of this. Okay, another one. This seems like a pretty simple one. Dirty linen out of the wash. So what does that look like? Well, it looks like failed hygienically clean biological tests, or just the textiles look dirty or they don't smell right. That's obviously a huge problem uh, because the linens aren't clean, so it's a patient safety risk. So how do we fix this? Well, we need to get to the root cause. And as I said earlier, it's time, temperature, mechanical action, and chemistry. One of those or multiple of those things are off. So we have to do the old root cause analysis and really investigate what could be happening. But it's definitely one of those things. Some examples: under loading or overloading the washer, as I said earlier, maybe the washer's not working properly, it's not spinning right, or the drains are broken, or the water is dirty. There's a whole slew of reasons this could happen, and we need to find that, correct the root cause, change the policies, training, and then always monitor the process. Solicit help from the infection prevention and control team, or maybe other experts that are washer experts from the washer manufacturer, or even other people to come in and do that. But dirty linen out of the wash, we can't do much if the linen coming out of there is dirty. Okay, next one. This is pretty obvious. This is an air handler. And on this side is dirty. On this side is clean. So we want to make sure that this air handler is working properly and doing what it's supposed to do, making positive airflow from the clean side to the dirty side. And sometimes when this isn't happening, the air handler is not strong enough, or there's doors open that are screwing up the airflow, or maybe the fans are there, but they're off, or maybe there's hidden gaps in the walls that are causing that. So, and this is obviously a problem because our clean linen is going to be contaminated with dirty linen, which is a problem. So to fix this, we want to fix the infrastructure under all conditions, doors open, uh, doors closed. We want to have policies to make sure we're looking at that. And again, solicit help from your infection prevention control team. Okay, here's another good one. So this is a small conventional wash deck. Maybe this looks like some of the laundries you work with. Here's the washers. Here's the dryers. These guys are really close together, and there's clean linens here, I think. But what if dirty linens are being loaded into here? They could bump into these guys. I see that all the time happening. So there's a big cross contamination risk, and the clean linen gets contaminated. How do you fix this? We need policies and training and checklists to correct this. So it's okay to be like this, but we need policies to ensure that the dirty stuff coming in here is never close to the clean stuff here. They never share carts. They never show people handling them. And then we need training on those policies. That happens so much. So I really want to call that one out. Okay, next one. I don't know if most of your laundries have an ironer. This is a sheet or a flat goods ironer, and all the time we see people feeding sheets in here or blankets or something long, and then what's happening here? These are dangling on the floor. Maybe this person's stepping on them, and there's contamination right there. And it's not just sheets; it's other linen dangling on the floor that can happen. So this is a problem because obviously these are contaminated. So to fix this, protect or clean the unclean surfaces like the floor. In the iron case, what we used to do in our laundry was we put a cleanable plate on the floor, cleaned it regularly, and then had the operators use booties in case they disposable booties in case they stepped on it. And then obviously we want people, if hands are clean, that's a surface. And if the policy, oh, I already have the booties there. So this is something that I see all the time where there are ironers, and it's a good thing to be aware of. Okay, next one. I've gone through this a lot, so I won't spend much time on this. Just surfaces. This is clean linen. This is clean linen. This is clean linen. Are these surfaces, these carts clean? Are her hands clean? Is her uniform clean? Is this light table clean? Is that phone clean? These are all infection risks. So dirty surfaces are just as dangerous as linen that has not been cleaned. Shelves, conveyors, floors, tables, they can contaminate clean linen. And then we just need good cleaning policies, training, proof of execution, and monitoring of that. Here's another big one, and this was mentioned in some of those outbreaks that happened. Damp textiles leaving the plant. And again, pathogens love moist, warm environments, and they can contaminate linens. So it's a patient safety risk, and it's also an optics risk. If a patient gets a damp sheet or towel, that's never a good thing. So we need to determine the root cause. Is it dryer settings? Maybe the dryers are too low. Maybe it's really cold out or very, very damp in the laundry. So we have to crank up the dryers. Ironer settings, ironer might be too fast or too cool. Load sizes might be too big. Important to correct the root cause, modify the policies for this. And what I like to say on this is this is something you always want to be on top of because weather changes, environments change, textiles change, and the dryer setting for August is probably very different than the dryer setting for January, depending on where you are. So it's very important to constantly be monitoring that uh, throughout the year and really throughout the day to make sure that your loads are always optimally dried. That's a big risk. And the I think this is my final one is in the truck, uh, unclean textiles during transport. So textiles not being protected, these are protected. That's good. These are protected. That's good. Uh, and this is obviously, if these aren't protected, they can get contaminated from the environment, which we don't control on the journey from the laundry to the hospital. So we want to make sure that these surfaces are all cleaned regularly. The linens are protected in here, hand hygiene, functional separation, all that stuff as well. And document that with checklists and training. Oh, I had one more. I talked about this before. This is dirty uniforms touching clean linen. So I just circled this. If this uniform's not clean, these are clean scrubs. Guess what? That person could become contaminated or contaminate healthcare workers or patients through that transmission, which I went through earlier. Or these are scrubs. And I just put these scrubs because I went a little bit about wearing scrubs home. There's some controversy on this, and I'll get this is my personal opinion and the opinion of others in the industry, but I don't I can't say it's the law because it's not, but I think it's always a good idea to have uniforms in the either the laundry or in the hospital that are professionally cleaned and available right there. In other words, don't bring them home and bring them back, because if you bring them home, you don't know what you're bringing home to your family, and then if you bring them back, you don't know what you're bringing back to the hospital. So I always think it's a good idea to have professionally laundered uniforms available in either the hospital, the clinic, or the in the laundry. Okay, so now this is the end of the meat part of the presentation. So let's do quiz time again. How many infection prevention risks do you see? So I'm going to open up the chat again. So in fact, I won't even count them, but let's have people in the chat start calling out infection prevention risks that they see in this laundry picture, which I showed earlier, now that we're all armed with our better observation eyes. Okay, so first one, there's actually a lot. So I will start with one. So up here, this is a duct from a dryer. This is in disrepair, so lint can be coming out and coming down on these clean textiles. Okay, another one, this is a washer. This washer's in disrepair. So if when this thing extracts, water is going to be splashing out of here, and there might be chemistry in there. So these textiles might not be getting clean from that. Okay, here's a cart with clean linen. There's tape on that. Tape's not cleanable. And these wheels kind of look like they're in disrepair. This is a maintenance room that these flaps are open here. So maintenance rooms are kind of dirty places, and textiles, there could be contamination of textiles from this area. Here's a big no-no. This is a fan, and this fan is blowing air in a dirty area that could go right here and contaminate these textiles. That's a few. Anyone else have others? Okay, I will. Here's more circles on them. So this is unprotected clean lining just sitting there. There's the tape one. There's a drain that's right there. This cart's going over that. That drain has obviously not been cleaned, and things could splash up from that. This guy doesn't seem to be wearing PPE, and he's in the dirty side right here. There's wood in this area. Wood is a contaminant, and wood can harbor pathogens, and wood is not cleanable. There's not a lot of distance between these guys. right here. And I think that's everything. Okay, so I'll end with on a sad note. Here's some real world consequences of contaminated linen. So Children's Hospital in 2009, um, 5 children tragically lost their lives, and it was traced to contaminated linen. The linen was cleaned, but it was contaminated on the way to the hospital. It wasn't covered up. It wasn't covered up in the finish area, the staging area of the laundry, and it wasn't covered up in the truck. And then it got contaminated with a um, some spores of a fungus, and tragically that was traced. It actually ended up getting on some immunosuppressed kids, and that's what happened. So that's what happens if we don't follow these standards and protect linen. This one, mold at 2 Pittsburgh hospitals, was linked to 5 deaths in an organ transplant unit. And this had to do with damp textiles leaving the plant, and then inadequate protection of the linens in the plant, and also unclean dryer air coming in from the outside that was contaminated. And again, very, very preventable, and tragically resulted in the loss of life. So, key takeaways: healthcare linens can contribute to the spread of germs. Hopefully, I've made that abundantly clear. All soiled linen is dangerous, no matter where it is. So, protect yourself, protect surfaces around it, protect clean linen, protect patients. Clean healthcare linen, hopefully, I've made this pretty clear, requires more than the wash. So, we need to wash it and get it clean, but we need to protect it after the wash. And there's a lot of steps there. Look for hidden risks with dirty healthcare linen. They're everywhere. Hopefully, I've pointed out a couple. Um, Keeping laundry clean after washing it until it gets to the patient or resident. Keep it clean, protect it, protect surfaces, protect air, protect hands, protect uniforms, and then make sure there's a dirty and a clean laundry area through functional separation practices. And laundry contamination is often hidden. It's not always visible. That's why we have those Sherlock Holmes uh, glasses that we have to wear. So here's some references from my presentation, and we'll send this out, and then I will open it up to questions now. So, Adrienne, I don't know if you want to open or take people off of mute, or if you want to ask questions uh, just through the chat.
The floor is now open for any questions. We did not have any questions or comments during your presentation, Craig.
Okay.
And with 2 minutes to the top of the hour, again, as anyone think of anything that comes to mind, you can always note, you can write your question in the evaluation. The evaluation should take you less than 2 minutes. So if you click on it now, you can complete it by 5 o'clock and you'll be completely done with today's webinar. But definitely want to take the time to give a round of applause to Greg for joining us today. So use your emojis to show appreciation for him joining us. We appreciate that greatly. Again, please consider completing today's evaluation. You must complete the evaluation to get continuing education units for attending today's live session. So if you want the CEUs, you must complete the evaluation. Even if you don't want the CEUs, you just want to provide input about how you felt about today's webinar, please do so there. If you have additional questions, please also use the evaluation for there, or you may just email me. But all feedback is valuable and it is appreciated, and it helps us to continue to improve and make these webinars meaningful to you. And so with nothing else, if all hearts and minds are clear, please know our next webinar will be October the 18th with Sarah Stream, and we will be talking about dental IP. So for all of our healthcare providers and nurses that work in a dental setting, please note, we're going to have a special one for you on October the 18th, but definitely take your time, complete those evaluations. I will follow up with a recording and a copy of these slides and with any resources that was mentioned in this presentation. If nothing more, you all have a blessed day, a blessed evening, and a blessed weekend. Take care. Bye-bye.
Thank you, Adriana. Thank you,
Thank
everyone.
you.